Defining child abuse. Recognizing key criteria. To help answer the question, what is child abuse and neglect? Remember that 4 key criteria must exist for the DCFS hotline to accept the report. 4 key criteria for a child abuse or neglect report. 1. The alleged victim. The child under the age of 18 who is suspected of being a victim of child abuse or neglect. 2. The alleged perpetrator. The alleged perpetrator is a parent, guardian, foster parent, relative caregiver, paramour, any individual residing in the same home, any person responsible for the child's welfare at the time of the alleged abuse or neglect, or any person who came to know the child through an official capacity or position of trust in settings where children may be subject to abuse or neglect. 3. A specific incident or specific set of circumstances raises suspicion that a child has been abused or neglected. 4. The child was harmed or is at substantial risk of physical or sexual injury. Reporter tip number 3. While an alleged perpetrator is the person who either directly causes or allows child abuse or neglect to occur, there are different definitions. For DCFS purposes, this includes any individual residing in the child's home, any individual responsible for the child's welfare, or anyone who came to know the child through a position of trust, such as mother, father, teacher, counselor, or coach, to name a few. If the perpetrator does not fit within one of the above categories, the incident may be a crime, but it is not classified as child abuse. For criminal matters, a perpetrator could be anybody. If you are not sure that a situation meets these criteria, call the hotline anyway. It is DCFS's job to assess the situation. Recognizing types of child abuse and neglect. The first step to fulfilling your role as a mandated reporter is to recognize the 3 main types of abuse and neglect that are legally acknowledged in Illinois. Physical abuse. Physical abuse occurs when a parent or a person responsible for the child's welfare inflicts or allows a physical injury to a child that is non-accidental, including bruises, bites, bone fractures, cuts, welts, and burns. Creates or allows a substantial risk of physical harm to a child. Violates a court order that prohibits the perpetrator from having access to the child. Deliberately inflicts or allows cruel or unusual punishment, which results in physical or mental suffering by the child. Inflicts or allows excessive corporal punishment. If a parent or caretaker causes physical injury during overly harsh discipline, it does not matter that he or she did not intend to hurt the child. Gives or allows a controlled substance to be given to a child under 18 years of age. Exposes the child to the manufacture of methamphetamine. Possible signs of physical abuse. Possible signs of physical abuse are unexplained marks on the body, cuts, bruises, welts, burns, black eyes, fractures, or dislocations. Bruises or welts in various stages of healing, or in clusters or patterns in the shape of an object, like a belt or an electrical cord. Pattern burns, such as cigarette burns, iron burns, burns in the shape of a specific object, or scald burns in an immersion pattern. Marks hidden from typically exposed areas of the skin. Other children may show more subtle indicators, such as behavioral changes, including extreme vigilance or watchfulness, bullying smaller children, poor social interactions with peers, extreme fear of parents or caregivers. Harming animals. You may notice some of these signs after a child has missed school, counseling, or other appointments for a period of time. However, be aware that some children will not display an overt behavioral change. Sexual abuse. Sexual abuse occurs when a parent or a person responsible for the child's welfare commits any of the following acts. Sexual penetration. This means any contact between the sex organ of one person and the sex organ, mouth, or anus of another person. Acts include vaginal, anal, and oral sex. Sexual molestation of a child. This occurs when the perpetrator touches the child or asks the child to touch him for the sexual gratification or arousal of the perpetrator or the child. Examples include fondling a child or having the child fondle the perpetrator. Sexual exploitation. This is the sexual use of a child for sexual arousal, gratification, advantage, or profit, as defined by DCFS. It includes child pornography, forcing a child to watch sex acts, or exposing genitals to a child. Possible signs of sexual abuse are sexual knowledge beyond what is age appropriate, recurring pain or itching in the genital or anal areas, sexually transmitted diseases, frequent bladder or urinary tract infections, genital injury, unexplained regression or fear, sexual acting out behavior. Some examples of sexual acting out behavior include, but are not limited to, a child forcing another person to do things that are sexual in nature. For example, a child telling another person to take off his or her clothes or trying to forcibly undress the other person. Another example is a child who aggressively tries to touch the genitals of adults or other children and gets angry when they are prohibited from doing so. Sexual acts that children do with themselves. These may include exposing their genitals in public and getting angry when told not to do so, or touching or rubbing their own genitals to the point of hurting themselves. It is also important to assess the development age of the child or children and to consider any differences in power between them. When two children of the same age are involved in sexual exploration, it may be perfectly normal. It becomes a point of concern when one child uses force, bribery, or threats, or when the acts show sexual knowledge that is not appropriate for the child's age. For example, it is not age appropriate for a 4-year-old child to ask another 4-year-old child to perform oral sex. Adults should be aware, not only of the age of the child, but also their development level and power position. If two 10-year-olds are engaged in sexual behaviors, but one of them is developmentally delayed and functioning at a 4-year-old level, you should suspect child abuse. Also, if one child is physically larger or stronger than the other child, this should raise your suspicion of child abuse. Some children will not display any overt behavioral changes. Sexual predators often abuse children in ways that do not leave physical signs, such as fondling the child, exposing themselves to the child, or having the child perform sexual acts on the adult. Even sexual penetration of a child does not always leave obvious physical signs of abuse. Neglect. Illinois enforces minimum parenting standards. According to DCFS, neglect occurs when a parent or responsible caregiver fails to provide these minimum requirements for the children: adequate supervision, medical care or attention, food, clothing, shelter. Neglect may also include significantly delaying the provision of these necessities, such as failing to take a child who has a broken bone for medical treatment. Other forms of neglect include taking illegal drugs during pregnancy, placing a child at risk of harm, or exposing a child to hazardous living conditions. Any child who is present during the manufacture of methamphetamine is considered abuse and/or neglect. Do not assume that poverty equates with neglect. Most parents are able to provide the minimum requirements for their child. Possible signs of neglect: often hungry in the morning, poor hygiene, evidence of none or poor supervision, underweight, poor growth, failure to thrive, dressed inappropriately for the weather, erratic attendance at school. Human trafficking. Sex trafficking, in which commercial sex act is induced by force, fraud, or coercion, or in which the person induced to perform such act has not attained 18 years of age. or the recruitment, harboring, transportation, provision, or obtaining of a person for labor services through the use of force, fraud, or coercion for the purpose of subjugation to involuntary servitude, peonage, debt bondage, or slavery. Possible signs of human trafficking. The youth has recent signs of physical abuse and or sexually transmitted infections. Suspicious tattoos and branding on the neck and lower back. Small children serving in a family restaurant, appearing malnourished, avoiding eye contact, social interaction, and authority figures like law enforcement, seeming to adhere to scripted or rehearsed responses in social interaction, lacking official identification documents, appearing destitute, lacking personal possessions, checking into hotels or motels with older males and referring to those males as boyfriend or daddy, which is often street slang for pimp, working excessively long hours, living at place of employment. Dealing with psychological abuse. The damage caused by psychological abuse may be just as serious as any other form of abuse and neglect. DCFS recognizes that emotional trauma is an element in many abuse and neglect situations. In Illinois, psychological, mental, or emotional abuse is known as mental injury and may only be reported by licensed medical and mental health professionals, including psychiatrists, registered psychologists, medical doctors, registered nurses, certified social worker, school teachers, therapists and counselors employed in a community health agency or social service agency. If you suspect mental injury, but you are not one of these licensed professionals, it may be appropriate to refer the child to a qualified reporter for an assessment. If you are not in a position to make a referral, you may want to consult with your supervisor, manager, or licensing representative. Which children are at risk? Actually, all children are at potential risk of child abuse. However, the following groups tend to be more vulnerable. Preschool children. Many people find it hard to believe that preschool children are abused, but it does happen. Preschool children are vulnerable to any type of abuse because they may not be able to talk yet. Even if they can talk, they may not know the words to describe what happened to them. In addition, preschool children are dependent on adults for all their needs, and they are not necessarily seen by many adults other than their caregivers. They may suffer several physical injuries, but are unable to tell adults who hurt them. Sexual predators may target preschool children because they are unable to tell what is happening to them. Sexual predators often abuse children in a way that does not leave physical signs, such as fondling the child, exposing themselves to the child, or having the child perform sexual acts on the adult. Even sexual penetration of a child does not always leave obvious physical signs of abuse. Physical symptoms and behavioral changes may be the only signs a nonverbal preschool child is being abused. There is a popular belief that preschool children are inherently unreliable sources of information. Child sexual abusers know this myth and exploit it to their advantage. Research has shown that if questioned properly, even very young children are reliable sources of information. Children with disabilities. Disabled children are those with intellectual disability, speech or language impairments, emotional disabilities, learning disabilities, and physical health impairments. Children with disabilities are vulnerable to abuse for several reasons, including family stress. If parents do not have the resources and support available to help them care for the child, this may lead to extreme stress on the caregiver and may place the child at risk for abuse. Stress does not excuse abuse and should never be used as a justification to use extreme force on any child. It is important to recognize that parents caring for disabled children may need additional support in dealing with stress. Isolation. Some children suffer from extreme isolation due to their disability. Isolation from others may provide abusers more opportunity to abuse the child without being discovered. Dependency on caretakers. All children are dependent on their caretakers for basic needs. Disabled children may be even more dependent due to their disability. For example, some children with disabilities are dependent on adults to take them to the bathroom or to bathe them. This not only leaves them more vulnerable to abuse or neglect, but may also add their reluctance to tell others about abuse or neglect by caretakers, due to the fear that they will not have anyone else to take care of them. Difficulty with communication. Children who have physical disability, such as being blind, deaf, or unable to speak, may not be able to describe the event to others. Abusers are well aware of this fact and often target this population, believing they will not be able to tell their story. As with preschoolers, there is a myth that children with certain disabilities are unreliable. Even if a child cannot talk or only expresses herself with difficulty, this should not prevent you from making a report if you suspect child abuse. DCFS investigators have several techniques they can use to communicate with nonverbal children. Gay, lesbian, bisexual, transgender, and questioning youth. It is natural for adolescents to engage in sexual exploration. Many children discover their sexuality before or during adolescence. This means that youth may be talking to their peers, parents, and/or adults about these issues more openly and at an earlier age. In contrast, gay, lesbian, bisexual, transgender, and questioning youth often have less social supports and less opportunity for discussion than their heterosexual peers, as they often fear ridicule or rejection from those closest to them. Gay, lesbian, bisexual, transgender, and questioning youth are at higher risk of isolation from peers, discrimination from adult figures, and punishment from parents. Some youth even become homeless after they share their sexual orientation with their parents. Although some sexual abuse victims are gay, some people have the mistaken belief that boys who were sexually abused by men always become homosexuals. This is simply not true. This myth only makes it more difficult for boys to disclose their sexual abuse histories. Sexual predators may intentionally target youth who are gay, lesbian, bisexual, transgender, or questioning, because they know there's a chance these youth may not be supported by the adults in their lives. Gay, lesbian, bisexual, transgender, and questioning youth may be ashamed to tell others that they were sexually assaulted by someone of the same gender, especially if they are questioning their identity, or if they were punished, ridiculed, or rejected when they disclose their sexual orientation. Reporter tip: if a child of any of these higher-risk populations tells you he or she is being abused, help protect the child by calling the hotline at 1-800-25-ABUSE. What is not child abuse or neglect? It is important to understand what is not child abuse or neglect. Some people make reports that DCFS does not legally recognize as child abuse. Here are some examples of situations that do not fall within DCFS's mandate to investigate child abuse. Certain sexual behaviors in children are normal and age-appropriate. Children who are curious about their own bodies. Preschool children who giggle while touching their bodies in an exploratory manner. Children of the same age and development stage who are curious about and explore each other's bodies. Certain family circumstances are not considered abusive or neglectful. Spanking that is not excessive corporal punishment because it does not leave marks or injuries. A dirty home that is not hazardous. An older child left alone who is capable of caring for themselves. A child left in the care of an adult relative who has often cared for the child in the past, even if the parent has not made an arrangement for child care. A child who a licensed physician reasonably believes is 30 days old or less at the time the child is initially relinquished to a safe haven. For information, refer to the Abandoned Newborn Infant Protection Act and www.saveabandonedbabies.org. Now let's practice recognizing possible signs of child abuse. Possible signs of child abuse include A. Unexplained marks on the body. B. bruises or welts in various stages of healing. C. Burns that are in patterns. Or D. All of the above. Correct. D. All of the above are possible signs of child abuse or neglect. Neglect occurs when a parent or responsible caretaker fails to provide which of the following? A. Adequate supervision, medical care, food, clothing, and/or shelter. B. Schooling, school supplies, appropriate school clothes. C. Up-to-date immunizations. Or D. All of the above. Correct. The answer is A. The lack of adequate supervision, medical care, food, clothing, and/or shelter are signs of possible child abuse and neglect. Which of the following is not a sign of sexual abuse? A. Sexual knowledge beyond what is age appropriate. B. Recurring pain and itching in the genitals. C. Wearing or sleeping with multiple layers of clothes. Or D. Children being curious about their own bodies. The answer is D. Children being curious about their own bodies is not a sign of possible sexual abuse. Good job recognizing possible signs of child abuse or neglect. Remember, children are relying on you to recognize possible signs in real-world situations outside this training. Reporter tip number 5. When in doubt, make a child abuse report and let DCFS do its job by investigating.